Researchers at Harvard say 9 out of every 10 cases of type 2 diabetes never had to happen, and the reason comes down to food. A 16-year study of nearly 85,000 women, published in the New England Journal of Medicine, delivered that number. Dr. Frank Hu and his team at Harvard found that 91% of type 2 diabetes cases traced back to lifestyle habits, with diet sitting right at the center. Only 3.4% of those women met every low-risk criteria, and that small group carried a 91% lower risk of developing the disease. That figure refers to prevention. But here's the thing. In the years since that study, clinical trials have gone a step further. People who already had type 2 diabetes managed to put their disease into remission, not with expensive new drugs, not with surgery, but by changing what they ate. What we're covering today are the specific foods that drive type 2 diabetes, the clinical evidence showing the disease can go into remission, and what all of it means for you or someone you care about. Every claim in this video comes from published research, and I'll name the sources as we go. Before we get into it, please remember this video is for educational purposes only and does not replace medical advice. Always talk to your doctor before making changes to your diet or medications. Section 1. What actually happens inside your body? Understanding why quitting certain foods can reverse diabetes starts with understanding what goes wrong in the first place. Type 2 diabetes is a disease of insulin resistance. When you eat, your body breaks food down into glucose, which enters your bloodstream. And then your pancreas releases insulin to unlock your cells so they can absorb that glucose for energy. What happens in type 2 diabetes is that your cells stop responding to insulin the way they should. Your pancreas tries to compensate by pumping out more and more insulin, but eventually it can't keep pace, and blood sugar stays dangerously high. Most people never hear the next part. Professor Roy Taylor at Newcastle University has spent decades pinpointing exactly where this process falls apart. And his research points to one culprit: fat sitting in the wrong places. Not the fat stored under your skin, but fat that creeps inside your liver and your pancreas. He calls this ectopic fat. What Professor Taylor's work reveals is that when excess fat builds up in the liver becomes resistant to insulin, which drives up your fasting blood sugar. When fat piles up in the pancreas, it cripples the beta cells. Those are the cells that produce insulin. He published this framework as the twin cycle hypothesis in diabetes care in 2013. But here's the part that changes everything. Those beta cells are not dead. They are not destroyed the way they are in type 1 diabetes, where the immune system attacks and kills them permanently. With type 2, the beta cells have gone into survival mode and switched off their specialized function. Remove the excess fat, and they can wake back up. That is the science behind diabetes reversal. Professor Taylor also introduced a concept called the personal fat threshold, which means every person has a genetically determined capacity for storing fat safely under the skin. Once you exceed your personal threshold, fat starts spilling over into the liver and pancreas, and that's when diabetes begins. This explains something that puzzles a lot of people. 70% of severely obese individuals do not have diabetes because they haven't crossed their personal threshold. Meanwhile, some people at a relatively normal weight do develop the disease because their threshold sits lower. By the time someone receives a type 2 diabetes diagnosis, they've typically lost about 50% of their beta cell function, according to the UK Prospective Diabetes Study. That function can come back if you act early enough. Let's walk through the specific foods that push people past their personal fat threshold and fuel insulin resistance, starting with the one backed by the strongest evidence. Number 1. Sugary beverages. Dr. Vasanthi Malik and colleagues published a meta-analysis in Diabetes Care in 2010, covering 11 large studies and more than 310,000 people. Drinking just 1 to 2 sugary beverages per day raised type 2 diabetes risk by 26% compared to less than 1 per month. A 2021 analysis in the journal Nutrients expanded that to 34 studies and found each additional sugary drink per day bumped the risk by 27%. We're talking about sodas, fruit punches, sweetened teas, and energy drinks. These beverages trigger rapid blood sugar spikes, promote fat buildup inside the liver, and don't fill you up the way solid food does, which means you end up taking in more calories overall. Number 2. Processed meats. 2024 brought the largest global study ever done on this topic, published in The Lancet Diabetes and Endocrinology. Researchers analyzed data from over 1.9 million adults across 31 studies in 20 countries, tracking more than 107,000 diabetes cases. 50 grams of processed meat per day, roughly 2 slices of bacon or a single hot dog, raised type 2 diabetes risk by 15%. An earlier Harvard analysis from 2011 by Dr. Ann Pan, looking at over 442,000 people, put the number even higher at 32% per daily serving. Bacon, sausages, hot dogs, and deli meats all fall into this category. The damage comes from hemi iron causing oxidative stress that harms beta cells, along with nitrates, nitrites, and compounds called advanced glycation end products that drive inflammation. Number 3. Ultra-processed foods. Nearly 200,000 people across 3 large Harvard cohorts were tracked in a study published in Diabetes Care in 2023. Those eating the most ultra-processed foods faced a 46% higher risk compared to those eating the least, and each 10% increase in ultra-processed food in the diet pushed the risk up another 12%. A 2025 meta-analysis in the journal Metabolism, covering 14 studies and nearly 700,000 people, confirmed that pattern, finding a 13% risk increase per 10% rise. Packaged snacks, instant noodles, frozen meals, sugary cereals, and soft drinks all belong in this group. Number 4. Refined carbohydrates. White rice, white bread, and white pasta have had their fiber, vitamins, and minerals stripped away during processing. Dr. Frank Hu and colleagues analyzed 7 studies with over 352,000 participants in a BMJ meta-analysis from 2012. Each daily serving of white rice increased type 2 diabetes risk by 11%, and in Asian populations where rice serves as a staple, that number climbed to 55%. Flip that around, and a 2013 analysis in the European Journal of Epidemiology showed that 3 servings of whole grains per day cut the risk by 32%. Even a simple swap, brown rice instead of white, lowered risk by 16% according to a study from the Archives of Internal Medicine. Number 5. High glycemic index foods. The glycemic index measures how fast a food sends your blood sugar up. A 2024 analysis in the Lancet Diabetes and Endocrinology, led by Dr. David Jenkins and colleagues, found that high glycemic index foods raise type 2 diabetes risk by 27%. A finding confirmed by a 2025 meta-analysis in Frontiers in Nutrition. White bread, cornflakes, instant oatmeal, baked russet potatoes, pretzels, and rice cakes all carry a glycemic index of 70 or above, which means they spike blood sugar almost as fast as pure glucose. Number 6. Fried foods. Over 111,000 people were tracked in a study published in the American Journal of Clinical Nutrition. Eating fried food 4 to 6 times per week carried a 39% higher diabetes risk, compared to less than once a week, and that number jumped to 55% for people eating fried food 7 or more times per week. Weight gain drove much of this association, since frying dramatically raises the calorie density of food. Number 7. Red meat. That same 2024 Lancet study on processed meats also examined unprocessed red meat, and the finding was a 10% increase in type 2 diabetes risk per 100 grams per day, roughly a small steak. Swapping in nuts, low-fat dairy, or whole grains in place of red meat lowered the risk by 16 to 35%. One note on sugar that surprised a lot of researchers. A 2025 analysis in the journal Advances in Nutrition found the form of sugar matters more than the total amount. Sugar in liquid form from sodas and juice clearly increases diabetes risk. Solid added sugar, like in baked goods, did not show a clear independent link after accounting for other factors. The takeaway is that sugary drinks occupy a uniquely dangerous category. With the causes on the table, let's look at the clinical proof that type 2 diabetes can actually go into remission. The DIRECT trial, short for Diabetes Remission Clinical Trial, stands as the most rigorous test to date. Professor Roy Taylor of Newcastle University and Professor Mike Lean of the University of Glasgow led the study. The study was funded by Diabetes UK. It was a randomized controlled trial across 49 primary care practices in the United Kingdom, enrolling 306 participants, all diagnosed with type 2 diabetes within the past 6 years and not on insulin. The plan was direct. Participants stopped all diabetes and blood pressure medications, then went on a very low-calorie diet of about 825 to 853 calories per day, using formula shakes and soups for 12 to 20 weeks. After that came gradual food reintroduction with structured weight maintenance support. When The Lancet published the one-year results in December 2017, the numbers told a clear story. 46% of the intervention group achieved diabetes remission versus just 4% in the control group. And the connection to weight loss was tight. 86% of those who lost 15 kilograms or more went into remission. 57% of those losing 10 to 15 kilograms achieved it, and 34% of those losing 5 to 10 kilograms saw remission. And among those who gained weight, the remission rate was 0. 2-year follow-up showed 36% still in remission. 5-year data, published in February 2024, showed 13% holding on to remission. That 5-year number may sound low, but here's a detail that gets overlooked. Serious adverse events were cut in half in the intervention group compared to controls. Temporary remission still delivered lasting health benefits. The Virta Health study took a different path. Instead of slashing calories, it used a very low carbohydrate diet, under 30 grams of carbs per day, to put participants into nutritional ketosis. Dr. Sarah Hallberg, Dr. Stephen Finney, and Dr. Jeff Volek led the study across 349 adults. 1-year results showed 60% reaching an HbA1c below 6.5% without medications, and 94% of insulin users reduced or eliminated their insulin. By 5 years, published in 2024, 20% maintained remission. This study was funded by Virta Health, and several authors were company employees, which is a conflict of interest worth noting. One of the largest studies ever conducted, the Diabetes Prevention Program, appeared in February 2002. Over 3,200 people participated, and lifestyle intervention cut progression by 58%. For adults age 60 and older, the reduction climbed to 71%, which directly concerns you. A newer study called Retune tested an idea that surprises many people, whether those who are not obese can reverse diabetes. 70% of non-obese participants achieved remission with just 6.5% body weight loss. This confirms Professor Taylor's personal fat threshold concept. Severe obesity is not a prerequisite for this to work. Compare all of that to standard medical care, which achieves diabetes remission in roughly 0.14 to 0.23%. That means more than 99% of people on conventional treatment never reach remission. The dietary interventions we just covered produced remission rates dozens to hundreds of times higher. Section 4. If you or someone you love has type 2 diabetes, the next question is, which eating pattern works best? Several approaches hold up in research, and the right one depends on your individual situation. Direct's very low-calorie approach carries the strongest trial evidence, with 46% remission at 1 year. That said, the trial never tested it in anyone over 65, and there are risks for older adults. Risks include muscle loss, gallstones, and nutritional deficiencies. Medical supervision is non-negotiable. Virta Health's very low-carbohydrate approach produced 60% reversal at 1 year. Drawbacks include possible LDL cholesterol spikes, kidney stones, and the need for medication adjustment. Cutting carbs without adjusting insulin can trigger dangerous low blood sugar. This is critical. For those of you over 60, one approach carries a strong safety record, the PREDIME trial. The study enrolled over 7,400 high cardiovascular risk adults between 55 and 80. The Mediterranean diet groups experienced a 52% reduction in diabetes risk with no calorie restriction. New evidence for the DASH diet specifically targets older adults as well, via the DASH for D trial. After 5 weeks on the DASH diet, mean glucose dropped and time spent in optimal range went up. Participants with higher A1C gained 3 extra hours per day of good blood sugar control. Dr. Neil Barnard led a National Institutes of Health-funded trial on plant-based eating. A low-fat vegan diet brought HbA1c down significantly more than the standard ADA diet. 43% of the vegan group reduced their medications versus 26% in the ADA group. Intermittent fasting has drawn attention from a Chinese clinical trial published in 2022. 47.2% of participants achieved diabetes remission against 2.8% in the control group. For older adults, fasting brings real risks, including muscle wasting and dizziness that can lead to falls. This should only enter the picture under close medical supervision. The American Diabetes Association now recognizes 7 different meal patterns as valid for managing diabetes. They stated that reducing carbohydrates carries the most evidence for improving blood sugars, marking a real shift. Section 5. The honest truth about long-term results. You deserve the full picture on what the long-term data actually shows, because the news is mixed. DirecT's 5-year results paint a sobering picture. Of those who achieved remission at 2 years, only 26% held onto it at 5 years. Virta Health tracked a similar decline, with remission falling from 60% at 1 year to 20% at 5 years. Weight regain drives most of that drop. When the weight returns, so does the diabetes. That's why the American Diabetes Association landed on the word remission rather than reversal or cure. Their 2021 consensus report, published in Diabetes Care, defines remission as an HbA1c below 6.5% measured at least 3 months after stopping glucose-lowering medications. The terms reversal and cure were deliberately rejected because remission can slip away. And yet, even temporary remission pays off for years to come. A long-term analysis of the Look Ahead trial, published in Diabetologia in 2024, found that people who achieved even brief remission ended up with 33% lower rates of chronic kidney disease and 40% lower rates of cardiovascular disease compared to those who never reached remission. What the research tells us is clear. Dietary changes can put type 2 diabetes into remission, especially for people diagnosed within the past 6 years who managed to lose enough weight. Holding on to that remission means holding on to those dietary changes for the long haul. This is not a one-time fix, it's a permanent shift in how you eat. Section 6. What about the new weight loss drugs? Many of you have asked how dietary approaches stack up against the new GLP-1 drugs like Ozempic and Wegovy that dominate the headlines right now. These medications do produce real weight loss and can lead to diabetes remission in some patients, but the details matter. GLP-1 drugs run between $2,400 and $4,200 per year at current U.S. prices, while a direct-style dietary intervention costs a few $100s total. A small NHS comparison study from 2025 found the dietary program actually achieved faster and more substantial weight loss than the drugs. Then there's the rebound problem. A 2025 systematic review published in eClinical Medicine by The Lancet documented metabolic rebound after people stopped GLP-1 drugs, with weight regain, rising HbA1c, and climbing blood pressure all showing up in the data. The broader cost picture deserves attention too. Medicare spending on Ozempic, Rybelsus, and Mounjaro jumped from $57 million in 2018 to $5.7 billion in 2022. Expanding Medicare. GLP-1 coverage for obesity would push projected drug costs to $66 billion over 10 years, while dietary interventions that deliver comparable or better remission results cost a fraction of that amount. None of this means the drugs don't work. They provide real cardiovascular and kidney protection, and they save lives. The gap is in investment, because dietary approaches that can match those outcomes receive far less funding and attention. Many experts now see these as complementary strategies, with some proposing GLP-1 drugs for initial weight loss, followed by a transition into a sustained dietary program. Section 7. Safety Notes for Adults over 60. If you are over 60, this section was written with you in mind. Very low-calorie diets and extreme carbohydrate restriction carry specific risks for older adults, which is why the DIRECT trial excluded anyone over 65. Sarcopenia, the loss of muscle mass, tops the list of concerns. Losing muscle at this stage of life increases fall risk, limits mobility, and can send overall health into a downward spiral. Studies show that over 50% of elderly diabetic patients face malnutrition or the risk of it. Geriatric specialists stress that eating adequately and preserving muscle mass should come first for older adults with diabetes. Blood sugar control comes second. Protein intake needs to reach at least 1 gram per kilogram of body weight per day for anyone at risk of frailty, and glycemic goals should be tailored to the individual and often relaxed compared to younger patients. Based on the research, the safest dietary approaches for adults over 60 are the Mediterranean diet, tested directly in adults aged 55 to 80 in the PREDIME trial, and the DASH diet, studied in adults with a mean age of 67. Both offer broad nutritional coverage, both hold up over the long term, and neither carries the muscle-wasting risks of very low-calorie or very low-carb plans. Whatever path you consider, do not change your diet or medications without talking to your doctor first. That goes double if you take insulin or sulfonylureas, because cutting carbohydrates without adjusting those drugs can send blood sugar dangerously low. Conclusion. Let's bring it back to where we started. 91% of type 2 diabetes cases in the Harvard study traced back to lifestyle factors you can change, with diet at the center. Clinical trials have since demonstrated that changing what you eat can put the disease into remission, 46% in the DIRECT trial, 60% in the Virta Health study, and a 71% risk reduction for adults over 60 in the Diabetes Prevention Program. The foods fueling this epidemic are no secret: sugary drinks, processed meats, ultra-processed foods, refined carbohydrates, high glycemic index foods, and fried foods. Evidence linking these items to type 2 diabetes comes from studies tracking millions of people published in the world's most respected medical journals. Right now, over 40 million Americans carry a diabetes diagnosis, and more than 115 million live with prediabetes. $412.9 billion, that's the annual cost, with 1 in 4 healthcare dollars in this country going to diabetes care. And yet, standard medical treatment achieves remission in less than 0.25% of patients. For many people, type 2 diabetes does not have to be permanent. Remission, though, is not a cure. Keeping it requires keeping the changes, which means medical supervision and a lifelong commitment to eating differently. Professor Roy Taylor put it this way, quote, "What we have shown is that it is possible to reverse your diabetes, even if you have had the condition for a long time. If you have had the diagnosis for longer than 10 years, then don't give up hope. Major improvement in blood sugar control is possible," end quote. If this video helped you, share it with someone who needs to hear it. Subscribe for more evidence-based health content and drop a comment below if you have questions. Thank you for watching and take care of yourselves.